That's all right. Action. Okay, as we're getting ready to do the sterile checkoff with Whirlpool, you're going to need to have a packaged towel. Okay, it's going to be your sterile towel you're going to use. To get it ready, okay, I have a fairly small towel. This one happens to be a washcloth, but there's some small towels around. Just fold it the way you normally would fold. Make sure that you have one edge that you can reach for once you get it open. Okay, you're going to put it in a pillowcase. Take the pillowcase, kind of fold it so it's about square. And it's easiest if you put the smaller side inside. Okay, and then the one that you folded up already, the flat edge should go toward a corner so that when you turn in your corners you have nice flat edges there. So put in your two sides first, then the two ends, and so you have a nice little package that has a little flap on it you'll be able to use. Okay? When you get ready to open that, remember you're going to be using your clean gloved hand to open, and then making sure that you're not reaching over the towel to the sides. Okay? So you're going to have at least two of those available, so we have two of those right here. You're going to have your sterile barrier that has the waterproof type barrier in it. Okay, you also need to have, do you have your stuff here? You're going to need your 2 rolls and 2 sterile sponges. Have those available. And then your gown, clean gloves, sterile gloves. So those should be the items you need as far as the wound. The usual things you'd have with any modalities, you're going to have your timer, your bell, for a loud one, and a sensation tester. Okay, so we'll get one of those out. Okay, in the lab, or in the clinic, when you actually do these, you'll probably toss out the sensation tester after you use it. Okay. Alrighty, so we have a therapist that has volunteered here, so Leslie, come on up, I'll do those for you. I'll let you use mine so yours doesn't get all wet with sterile barrier.
Okay.
Alright, so let's start talking her through step by step. What does she need to do first?
Temperature on the wound.
Okay, and if it's a wound, does anybody remember what the temperature needs to be? Should be on that chart.
96 and 98.
Good, 96 to 98. If it's an open wound, it should be 96 to 98 degrees
And
Fahrenheit.
97, so that's good.
Perfect. Okay, so it's 97 degrees. What's she going to do next?
Add the chemical.
Okay, add the chemicals, and I actually haven't done that yet. And while you're adding the chemicals, you can be checking to make sure that you're set up as far as your. Okay, I have that ready. Make sure you have the force and aeration where you want it. Let's say this is a patient that you can use maybe a light force, lots of bubbles. Maybe we're trying to get some pebbles out of a wound after a motorcycle accident. Okay? I guess we can use this one. Okay, there's that. All right, and go ahead and turn that right on so we can see how it feels. Yeah.
For lots of bubbles, when you turn it up and down, that now vertical.
This one make it down?
No, I'm talking about for bubbles, aeration, turn up and down.
It was like that. I thought it was already on, but, I mean off. So this makes it on.
Yeah.
And I got my pad all, like under it, but not totally closing it.
Okay. All right.
And I would probably lower this. And that might lock it. And that way lock
Go ahead and turn it off.
I'm trying to lock it, so is it,
Yep, that's as locked as it gets.
and it still rises up, yeah. So I was like,
It's staying down, of course, the right where we want it. I also brought over your
Yep.
large bag for linens
okay.
and your medium-sized bag for trash. Okay, what does she need to do next? Okay, check the patient's chart for the contraindications, which are?
Cardiac,
Incontinence,
instability,
seizures,
and
and,
seizures.
Okay, so I heard cardiac instability, I heard seizures,
And
and
bowel
I heard
incontinence.
bowel incontinence. Okay, good. Now what?
And they're all good. They don't have either three.
Wash your hands.
Okay, so now she would wash her hands, and in the checkoff, we'll just pretend. Okay, then what?
Bring the patient in.
Bring the patient in.
Hey, how are you today? Autumn. I did they?
Purpose?
Go ahead, I'm just getting these ready.
Oh, where does she have an injury?
Let's say on her right leg.
Okay, I heard that you have an injury.
Yeah.
And we need to clean that up for you today?
Okay.
Okay.
Okay, and let's say it's on the left malleolus, so that when she's sitting, we can put her in the chair. Let's put her in the chair so she's kind of facing, you know, bring it back here a little bit, so it's right down here, so we'll show on the camera.
I can't believe I just called it.
That's okay.
These towels. Okay, I'm gonna try
Now,
to-
I
I'm
put
gonna
it
do
this way, or
different.
should I turn it sideways?
She's gonna
Yeah.
put it on it, so we'll do it like
Yeah.
that. And I'm actually gonna move it a little bit different for this one, so that we
Okay.
can see her, so I'm gonna maybe step over
Okay.
for just a second. I'm gonna kind of put it over like this, and then when she gets in, she can just have the one leg in.
Right.
Instead of having both.
Okay.
Okay, so her left malleolus will be toward the turbine there. Okay, so she's checking to make sure that the wheels are locked.
Yep.
What else?
Um,
What's next, I should say?
Display purpose, what
Okay,
to expect.
yep, she did that, she said we're
Yep.
gonna clean out the
Yeah.
pebbles from the wound.
Can you let me know if there's any problems or if it hurts or, by towels? Fly gown, play gloves. For her leg, right?
Mhm.
Okay, now I'm applying my gloves or my gown?
Gown and
Gown
play
first.
gloves. You do it the same way you do in sterile technique?
Yep.
My gown doesn't have the threads.
And what's next while she's doing that? What's she gonna do next?
Remove dressings. Remove the
Oh,
dress.
gloves.
Yep, she's gonna put the clean gloves on next. You said that earlier, I just
Yeah.
wanted to give her a heads up on the next part here. And before she takes that other dressing off, she's gonna need to make sure she has her, garbage, so she'll have a place to put that dressing. And the clean gloves you can put on anyway, because those are for your own protection, but they do need to come up over the cuffs of the gown.
Now, am I gonna have her sit up here to remove her?
Yep,
Okay.
if she were on crutches, we'd show that other way, but.
Still need a
she
gait
doesn't.
belt or no?
Yep, we still want a gait belt, which, here.
How about it?
Right here.
Oh.
I'm getting her this here.
Okay. I'm used to it, trust me.
Alright, now I'm putting this on for you for my safety and for your safety while we're doing this procedure.
Okay, sounds good.
Alright.
Now,
Now,
I'm just
we're
kinda
gonna
hang on
come
while
to
she's
this
getting up.
chair.
Okay.
In the high chair.
Okay, and we just still do the shoulder thing?
If the patient needs it,
Okay.
yeah, it's
If not,
fine.
I can just
If
get up.
not, just make sure you're stabilizing the chair for it. And now, as a therapist, you wanna have that stool nearby so that you can sit, and if you would kinda sit so that the camera So it's her left leg. Patient, can you roll your pant leg up? Again, with a real patient, hopefully they would have shorts or something on. We're just doing this for the demo right now. Okay, so therapist, you're gonna use your gloves to take off the boot and the sock and put that way over out of the way. Okay.
Did all step on my toes.
Yep, and that's a good time, because there will be sock fuzz and things like that, so using your sock like that was a good idea. And what is she checking for?
Drainage and odor.
Okay. So if there was a bandage, let's say, what did I say, left lateral malleolus? Okay, so there's your bandage, so you would start to take that off.
And I have my trash closer.
Okay. And you would look at that,
Yeah, look,
and there's some red on it, so that would be the sanguineous.
Blood.
Some of the green would be the purulent or the pussy area, and then you would be able to notice if there was an odor.
stain.
And now I'm checking to see
That's
if
right.
there's any other wounds near it.
Yep, good, so she's checking behind the heel, under the foot, between the toes, any place that's gonna be in the water, she's checking.
Okay, and that all looks good.
Okay, all right, what's next?
Sensation.
Okay, sensation test.
Okay, now what I'm gonna do is I'm gonna, touch you gently with this. I will use this flat end and the sharp end, and I need you to turn your head for me to the side.
You don't have to poke me or I'm not pretty sensitive.
Okay,
Okay.
and I'm gonna fast forward at this point.
Okay.
You would do the sensation test, you know, the whole area that's gonna be in the water, checking for sensation. If the patient's fine with sensation, go ahead and throw away the sensation tester there. Okay, then what?
That's this patient in the Whirlpool.
Okay, so
Your
she'll
gloves
assist
still
that
on.
extremity, yep.
BJ, with the sensation test, can you skip doing like a hand or another extremity or do it
Go.
You should do it the regular way, because you need to know if they're
You were hoping.
appropriate with their answers. Because that's testing to see do they know